is Women Who Code. So basically, Women Who Code is actually an international organization that is, we focus a lot on like getting initiative and getting women who is on the community. So to actually be involved in the tech community. And then actually Women Who Code Kuala Lumpur started in KL, I think it's around 2014, if I'm not wrong. And then we've been trying out this product series, product management series for this Women Who Code KL. And so far, I think we've started this for since last year, I think, and this is gonna be our 6th talk that you are joining us today, and it's actually our 2nd talk online. So welcome everyone. Very happy to actually be hosting this today. And so on the team that is bringing this to you, we have Brianna and myself, which is Vicky, and also Lisa, Alicia, Kim, and Christy. So yeah, we are part of the organizing team that is over here in Women Who Code. And just basically how I like to start off with is go on with a bit of house rules about how you can expect our talk to go through. So if let's say, so as we are going along with the talk, you can actually raise your hand to speak if you have any, if you have a dying questions or something like that. And because right now, I think all of you don't have, you are all unmuted as you are admitted into this talk. So if you would like to unmute yourself, you can raise your hand, and one of our co-hosts that is joining us for this event will actually allow you to speak when the time is right. And how you can actually do that is, I think there's a function on the right hand side of the screen that you can see, and yeah, you can try to raise your hand in that manner. Okay. And then other than that, you can ask as many questions as you want as we go along the way. If you have a question that you would like to address to our speakers, you can actually try to write it in our chat box, and then we can attend to your questions at the end of the session, so during the Q&A sessions. And it will really be helpful if you guys can actually write to which speaker that you would like to direct the question to as well. Okay. And yeah, so apart from that, we're also going to be taking a group photo at the end of the talk. So if we would really appreciate if you like stay back if you want to, and then by that time, I think we can just allow everybody to share screen and we can just take a group photo together. Okay, so just also be mindful that this whole session is recorded. So if you ever need to refer to any of the talks, to this talk in the future, you can, yeah, we will send out the link to this recorded session. Okay, so other than that, okay, so we are also going to be going through the agenda. So basically, we are actually introducing a bit about like Women Who Code and what we actually do and the organizing team. So that's our intro session for today. And then after this, I will be passing over to our first speaker, which is from KPISoft, which is Royston. And then later on, our second speaker will actually be Hazwan from DoctorOnCall. And then after that, two speakers, we actually have a Q&A session at the end, and then we also gonna be having a feedback and also a wrap-up session where you guys can help us to fill in a Google form and just tell us like what do you think of the talk in general, and like we really like to hear back from all of you guys. Okay, so I think right now the time is about 2:10, so I think we'll just move forward to the first speaker. Okay, so be introducing Roy from KPISoft, and he is well, based on how the previous time that we've talked together, he did mention that the KPISoft is actually the person behind like MySejahtera, right? And yeah, so really like to introduce him to you guys. So yeah, Roy, please take the please do share your
Okay,
I
sorry.
want to applaud, but I cannot.
yeah.
Thought you were gonna do the dirty work for me. No.
Roy, we just started. Come on.
Sorry.
Yeah.
All right. Hi everyone. Thanks
Hi, everyone.
for joining us today, I guess. So my name is Royston. You can call me Roy. So I'm a principal consultant at KPISoft. So my background was management consulting. Previously, before I joined KPISoft, I was part of Ernst & Young Advisory. And after that, I went into KPISoft, which is essentially a tech startup. I'll give you more details about what we do as a company later on in my talk. And yeah, so I'm the lead consultant for MySejahtera. So it's been a really interesting time through this pandemic where we were helping the government in terms of managing COVID. And yeah, hope to share more with you later on in this talk.
Yeah, cool. Great.
Okay, so Vicky, should I just take over from you?
Go ahead and share your screen. Yeah.
All right, sure. Just give me 1 minute. Okay, just checking if everyone can see my screen well.
Yes, we can.
Yep. Yes.
Okay, so I guess before I start off, I just want to say thank you to WWCode for inviting me to speak today. I think as a company, as an organization, KPISoft, we strongly believe in women in the tech space as well. And recently, we've been a proud signatory for the UN Women Empowerment Principles as well. So I think women in tech is something that we strongly believe in. Even globally, half of our team worldwide comprises of women actually. So I think it really defeats the stigma that tech is a male-dominated industry, and I think we're moving way beyond that. So jumping straight into my talk, so I guess 3 parts to my talk today. First, I'll go through a quick introduction about KPISoft, what we do as a company. As you know, we're not really a healthcare company per se before we started to help MOH in this pandemic, but that's when we kind of geared or tailored our product to assist MOH in that way. So just a bit about our company's background. After that, I'll give you more about the product journey of MySejahtera as a whole since we launched back in April until today, where we are in September. And also through that entire journey, we of course encountered a lot of challenges and lessons learned along the way, being a product that we had to roll out fairly quickly. So of course, there's going to be a lot of lessons that we have along the way that I want to share with you all from a product management standpoint as well. Okay, so just moving on to the introduction section. So a bit about KPISoft. We were founded in 2010, so not fairly recent, I would say, just about a decade ago. We are a SaaS-based platform company and we focus on enterprise performance management. So as you know, performance management meaning when you're going through your annual reviews, employees are assessing their performance, and that's kind of the area that we function. So we're a SaaS platform and a B2B platform. So basically we consult with our clients in terms of how we can roll out a product that best suits their needs around the areas of performance management. Globally, we have about 260 employees worldwide, and that includes about 15 offices in operation globally. So we have our main sales and consulting hub based out of KL. And we also have offices in the US, in Dubai, also in India, and also in Jakarta, to name a few. So in terms of our product or solution focus, I mean, there are 3 main elements where we kind of tailor our product to be focused on. So number 1, we want to guide organizations or our clients to a better purpose in terms of their corporate strategy and so on. And to do that also, we need to empower them with insights. So I think insights is something that every company is looking towards in terms of what kind of insights or contextual information that they can derive from their data to be able to make better decisions as a company or as a whole, essentially. And of course, we enable our clients to achieve the growth that they require. So I think clients these days, or even any company these days are always focused towards the next goal, which is to transform their business, whether it be towards a digitalization target or whether it be towards achieving a certain growth, whether it be related to their metrics or KPIs per se. Okay, so just a bit more about our company. So our problem statement that we really tackle is aligning the three main core areas of a company, which are the people, strategy, and operations. So as you know, the people aspect is more led by the CHRO, most likely. And that's where the person is looking towards, okay, how do we encourage employee retention? How do we look at, remuneration of our employees, and how do we encourage them to grow from a skill set perspective? While from a strategy standpoint, probably the CFO or the CEO are leading this section where they're looking at, okay, what's the next big thing for us? What's our short-term goals, medium-term goals in terms of achieving our strategic vision as a whole? And on an operational standpoint, which is probably led by the COO, that's more, okay, on a day-to-day basis, how are we tracking against our targets, or how are we leveraging from the data that we have and that we are collecting to achieve all these KPIs that we have set, to make sure that on the long run, we achieve our company strategy. And beyond that, we also have all the minor things that are supporting this vision of transformation, the goals, the KPIs, the incentives, interactions that we have with our clients, so that we make sure that we cover all these different aspects when we are looking at giving a targeted product or solution for our clients, right? So over on the right, you can see this is a sample of our core product, which you can see focuses on a scorecard approach where an employee can immediately see what are his scorecards, KPIs, and how is he tracking against his performance. So through our mobile application, an employee can immediately recognize how is he tracking against his targets, and also how is he helping the company achieve their overall goal as a whole. Because right now, I think what we see is, even from a lower level, the employees there, maybe they are a bit disconnected with a company strategy, right? So how do they feel that they are connected? And that's through us empowering them with this application and allowing them to see, okay, what KPIs am I helping the company with, right? And over here, it's also an end-to-end management system where you can go through a whole goal setting process, and also all the way to your reviews, and everything can be done digitally, right? So we're in a way replacing the manual paperwork that's being done in organizations. So I think that's just a bit of an overview about our company as a whole. So I'll just get right into the interesting part, or why you guys are here in the first place, which is MySejahtera. So I think MySejahtera is a government-based mobile application. I'm sure all of you have used it at one point, or maybe not the application, but at least the check-in feature, which we've rolled out to all our premises. So we're a government-based mobile application to digitize the management and contact tracing of COVID-19, right? And through this journey, we've partnered with a few of the government agencies, number one being namely, of course, the Ministry of Health themselves. And also we have two more agencies that we partner with. Number one mainly is NACSA. NACSA is the National Cybersecurity Agency for the government, and also MAMPU. MAMPU is the digitization and modernization unit of the government, who kind of supports and assists in all these initiatives, digitization initiatives, which are rolled out by the government. Right, so a bit of our journey so how did we came about? Well, previously we were kind of helping the Ministry of Health in several other initiatives. So we were in a stage of conceptualizing certain things that we could help them with, namely a disaster management application and so on. And that was through the end of last year to about the beginning of this year. And after that, as you know, COVID kind of hit all of us back in about January, February, March especially. So back in about March, that's when MOH approaches and say, hey, since COVID is really something that's taking off, we might need you guys to really help to come up with a solution where we can possibly digitize the management of it, right? So initially, when we first started discussion, it was supposed to be maybe a small base mobile application where we focus on about maybe 50,000 users, which are those PUS or PUI people, which is person under surveillance. And then probably we roll out to those targeted segments only, and maybe a way for them to monitor themselves. As you know, there's a 14-day quarantine that people have to go through when they are on a high risk towards COVID-19, right? But as you know, it's kind of blown out to be a public application so that everyone can use it. And I think that's when MOH wants to empower the community as well, which is why we opened the application up publicly after several rounds of discussion. And that's where everyone can get on board to the application and use all of our features. So initially, when we first rolled out, we had a few main core features that we had. So firstly was the self-health assessment. So the self-health assessment is where someone can perform a simple assessment which can categorize them according to what's their risk of possibly contracting COVID-19, right? Which helps MOH to identify, okay, how many people are maybe under the high risk bucket that we need to target and probably reach out to them for further action and so on. We also have a statistics module, as you know. Statistics is where we highlight what's the current statistics, day-to-day statistics for COVID-19, how many people, how many local cases, international cases, and so on. And also we highlight global statistics as well. You know, this is not only a problem that's happening in Malaysia itself, but I think every other country is facing this pandemic. So in a way, we are kind of benchmarking ourselves as well from how are we handling COVID-19 globally. And people can also assess that through the statistics that we have globally. And number three, we also have a hotspot tracker, which is one of our more popular features. So I think from hotspot tracker perspective, it allows people to identify or search whether their current or search location has possible contracted cases of COVID-19. Besides that, we have other digital health resources available. So for example, if the person wants to find where's the nearest health clinic or hospital for them to get tested, or for them to find any other materials regarding COVID-19, then we make these resources readily available for the public, for them to have essentially a one-stop shop where they can access all these different materials and resources. And I would say the second major milestone for our product was when we launched our QR code check-in feature. So as you know, when the government, about end of May, when the health DG announced that now all premises would require to capture visitor data as a way to contact trace, you know, essentially once MCO was lifted and people started to move about again, how do we tackle that, right? So QR code was something that most of the public is aware of, and it's something relatable to everyone and readily available on a mobile application. So which is why we went with that. And that's one of our most popular feature these days. And I think even now everybody is still checking in with MySejahtera as we speak, so that we continue to collect data, continue to assist MOH in terms of contact tracing and capturing these records. Besides that, we have added additional enhancements along the way since June, especially to our check-in feature. So for some of you, I'm not sure if anyone has traveled back to Malaysia recently, but when you travel back to Malaysia, you will have to undergo a 14-day quarantine period. And when you arrive at the airport, you actually have to fill up a comprehensive arrival form, which is basically where you came from, what date was your flight, and what's your seat number, and all those details that we capture from you, from those people that are coming back to Malaysia, right? And essentially what happens is we can monitor those people as they will be onboarded to the application. They will go through the 14-day quarantine where they also declare their health assessments. So that's a travel module that we are helping MOH with in terms of digitalization and improving their current operations. And most recently in August, I think these are more public features or enhancements where we have the check-in history, where people can now view where they have checked in the last 14 days or last 30 days or so, right? And also we have the check-in for dependents feature. So I think this is more targeted towards the segment of people with young kids who do not have access to smartphones or even elderly folks. So now that when you tag along or you bring your grandmother or your young child along with you, you can now check in along with them as long as they are onboarded to the system when through you registering them through your mobile app profile, right? So I think these are the more prominent features that we have released to the public recently. So for For my next section, I want to highlight a bit of our core application principles in how we came up or how we essentially designed MySejahtera in a way. So number one, we focus on empowering or community empowerment, which is basically focusing on features that can help people take action, right? So we didn't want to just be an application that purely focuses on assisting MOH, although of course that's always the goal, but we also wanted to help the public as well. So which is why we have a few features that are more targeted towards the community or the masses. So number one, as highlighted previously, our hotspot tracker. For hotspot tracker, knowing whether there's a possible contracted cases towards COVID-19 allows people to plan their journey. For example, they're planning to go grocery shopping nearby. They might want to search up the grocery store and highlight, okay, is that a high risk area? Or is there a possible case there within the radius of 1 kilometer? And allows them to make the call or make the decision whether, okay, do I want to really go there and be safe, or do I want to practice social distancing, or do I want to maybe travel to a different supermarket and so on. So it allows people to plan their journey and movements around. And the second feature, like highlighted previously, the self-assessment, where people who are undergoing quarantine can also do their day 1 to day 14 health assessments there. And also for people that are low risk, essentially the masses, because I think right now COVID-19 is trending towards, we are trending to reduce community spread, right? So how do we reduce community spread? It's through people self-declaring whether, okay, recently did they attend any mass gatherings, or recently had they traveled, or so on. So that really allows us to segment and target these focus groups in terms of what next actions that we can take with them. Now, on the second principle, we wanted to keep it simple and intuitive from a UI design perspective. So as you know, I think most people here, maybe coming from a product background, you would know that the number one use case for people getting on board your application or improving stickiness towards your application is the user interface itself, whether it's easy to use, quick to understand, because we are reaching towards a target market that's so wide, from young people who have smartphone all the way down to 12 years old, all the way to elderly people who still are somewhat digitally savvy, but still require a simple UI for them to navigate or function certain applications. So throughout our journey with MySejahtera, we had to validate a lot of market sentiments in a way, because this is something new for us and it's a learning journey as well, where we had to understand, okay, what comprises of what really helps people in terms of using our application, or how else do we improve people coming on board and make it easy for them to use our check-in feature or so on. So one prominent example that we use for the UI design was the main menu design. So I think previously when we first launched, not sure if there's any people there who use our application since the start, but previously our layout of our homepage was slightly different, where you had to click a button to access the whole drop down of main menu items. But right now, what we have done in about the last 1 month was that we've transformed our home screen to put up the 6 most used features right in the main menu itself, so that it essentially reduces 1 click for them to access these features. And 1 click may not sound like a lot, but I think from a user perspective, even 1 simple click for them to access certain features is very important for them. And it's something that we have to bear in mind from a product management standpoint. And lastly, the third point is, of course, we have to practice agile deployment when deploying this. So as you know, when discussions first started with MOH back in about late March, and we launched in about April, which gives us about 4 to 6 weeks essentially to launch this application. So it's a very short time period where we had to tailor a few things, and we had to really identify, okay, what's the minimum viable product, the MVP for us to launch, right? Because essentially if we wait too long for a perfect application, then again, it wouldn't serve MOH purpose because they need it fast. COVID is spreading, back in March or April when MCO was more prominent, there were a lot of daily cases and everything. Then that's when we had to act fast and make sure that these people got brought on board to the application. So it's kind of a balance of launching early versus making sure we have a minimum viable product to launch with. So, and of course, through our check-in feature, we are of course facilitating contact tracing, which is to identify, okay, where have the contacts been traveling to? For example, we can identify okay, this confirmed case, where did he visit in the past 14 days? And through that, MOH can contact these people and subsequently bring them in for testing and to prevent the community spread further. So through following these three main core principles, I would say we have a few success stories to share from MySejahtera. So I think as of the end of August, we have about 17 million users on board. So that's about close to 70% of the Malaysian population with mobile apps who are onboarded to our application. And of course, we hope to improve this number further. It can only go upwards from here. And from a qualitative standpoint, we also have an average 4.5 rating in Google and App Store. So in a way, it kind of validates our sentiments that, okay, our app is easy to use and that the market is responding to our application, giving us this feedback and reviews and saying that it's simple to use, it's intuitive, it's helping them save time, and so on. And not forgetting, from a Ministry of Health perspective, we have also detected more than 200 cases of COVID-19 through the application, which comes up to about 3% of the overall confirmed cases in Malaysia itself. So I think the number will only go up from here. From once we are in, I think right now we are in a state of stabilization. I think Malaysia overall is in a state of stabilization of COVID. So we want to make sure that we continue to help them and continue to prevent this community spread per se. Right, so just sharing a bit on the core application principles, and through the whole journey, of course, we have a lot of challenges and lessons learned. So as on the left-hand side, you can see that there's two main times or two main instances where we made public headlines. Number one was when the Health DG announced in his daily conference that the mobile app was flooded by 700,000 registrations, and this was during the announcement of the Penjana program, which is the 50 ringgit essentially. So the power of 50 ringgit essentially brought about 700,000 registrations to our applications within a matter of a few minutes after the announcement was made. So there were certain things that we had to react towards and make sure we control the performance of our application to make sure that there's no crashes and people can still continue to use our app. And I think the second picture there that you can see was fairly recent, and that's when the government announced that MySejahtera is now compulsory for every premise to use to log in visitor records, right? So I think announcing such a huge news like that, it's bound to have a lot of discussion points around it. And I think there were several people that came about and voiced their concerns about, okay, what in terms of data privacy, connectivity concerns, and so on. So I think this we had to, in a way, build confidence from the users from a data governance standpoint and assure them that, you know, the data is safe, secure, and that it's only used for the purpose of MOH's contact tracing, right? And that we are not using the data or for any other purposes. So on the, just to implore further on the challenges. So I would say the top challenge for our product team as a whole was reacting to the dynamic changes of COVID-19. So I think COVID-19 is a pandemic that we have never, in a way, seen before or encountered. And even coming from a normal B2B platform where we serve our corporate clients and suddenly being pulled into healthcare, a lot of our team had to essentially learn about, okay, understand about COVID-19, understand about the terminology that's being used, understand about how we can help MOH in terms of what can we do with the application. And also throughout the way, there's a lot of process and policy changes, right, done, because the government is still reacting towards COVID-19 because in a way, it's still an unknown. I think every nation has that problem where we do not know what to expect. Suddenly with the recent case of the super spreader that came out in Sivaganga, right, as an example, that there are all these new developments that are ongoing. So in a way, from an application standpoint, we had to react accordingly to all these policy changes, right, because of all these new instances or new development of COVID-19. So number two was going from a private application to essentially a public national application. So as you know, as I mentioned before, we are a B2B platform. So all our existing clients are corporations, right? And at most we will get thousands, tens of thousands of users at most. But right now we are at about 17 million users. So from a transformation standpoint, we had to increase our application durability up to more than 100 times, right? To essentially cope for the millions of people that are using our application. So actually what we did from a product standpoint is that we have to isolate a specific team that's working on this particular environment of MySejahtera. And after that, making sure that all our existing clients who are using our existing products and mobile apps are isolated from that sense, so that we differentiate the two products and we understand that this particular environment is purely used for MySejahtera itself, just due to the nature of the performance aspects that we have to consider in that particular environment, since it's a public application. And also we have to make sure that the application is always readily available for the public to use, since now from a policy standpoint, it's mandatory for everyone to use. So on the third point, we have to also establish user confidence through proper data governance, and that's back to the article that was highlighted on the left. So I think essentially building confidence to the public that the data is secure. We adhere to very strict regulations in terms of data. I think we are also PDPA compliant in terms of the Privacy Act. So we're making sure that whatever data that people submit or check in is only used for contact tracing purposes by the Ministry of Health. So I think internally, we also have a very strong process that we follow to make sure that people who actually request the data are only exposed to a select few under the MOH team that really works on contact tracing. So even then, while we are balancing to enable them to have the data fast as well, so it's a fine balance between making sure we properly govern the data versus also making sure that this data is readily available for them to immediately track the person, whether this person has went out to a lot of places in the last 14 days and really needs to, in a way, be called in for testing and so on. So a bit of lessons learned along the way as well. From a lessons learned standpoint, I think we always have to consider the big picture for each enhancement that we do. And this is especially from a performance standpoint. So as you can see in the first problem statement that we have, where the DG announced about, or there was the announcement about the Penjana program, that's when we really got a large load of people into our application, which actually caused high traffic to our registration module. So we actually had to isolate the registration module and make sure that our existing users in the application were not affected. So essentially it's making sure that the users already onboarded to our application can still continue to use the features in the application, and versus the people who are trying to get registered into our application. So we've isolated all this so they are not dependent on one another. So that's one of our strategies in terms of how we did load management into this application. Right, so even any particular enhancement we do, whether it be just a small button that we enable in the application, always have to have that performance consideration in mind, where you think, okay, is there a particular server call being made if a user, clicks on this button, and what would that cost be, right? Because essentially when you're dealing with the public, you can't really be too sure about user behavior when using the application. When we first launch, we aren't really sure, okay, what kind of features will our users most like to use? Maybe it's probably the hotspot tracker, right? But probably when we first launched, it's still a gray area where we had to make certain guesses. So I think in a way we had to react accordingly based on what we see or what the market sentiments are to this particular product. So on the second point in terms of lessons learned is always to prepare for contingencies. So I think unfortunately we did not have the luxury of time to prepare for too many contingencies because we launched in about 4 to 6 weeks. But I would say what we done well is we reacted very well in terms of the policy changes that happened, or in terms of the public giving us feedback on our application as well. So I think whenever public gives feedback, I think Malaysians in particularly are generally quite tech savvy. So generally they do have a lot of constructive feedback to deliver, whether it be on social media or whether it be through our email support, where they highlight all these challenges or usage to us. And of course, coming from a product management standpoint, we had to react accordingly to those comments that are coming in to make sure that we are also demonstrating to the users that we are accepting their feedback and we are taking constructive criticism as a whole, right? Because I think one major component of this management of COVID-19 is making sure we are listening to the people as well. Because as mentioned, one of our core app principles is community empowerment. So we need to make sure these people's feedback are properly taken into account and in a way valid, and also for us to consider whether we can explore how else can we help this user or what else can we do within the application to help this user. And I think the last thing is to prioritize even when everything is a priority. And I'm sure this is something most people can relate to. But there is a good quote that someone did mention to me. If everything is a priority in your list and you can't prioritize, then you're probably not doing it right. Because I could say that coming from us doing this MySejahtera project, essentially I can tell you everything was a priority, especially when it comes to dealing with the Ministry of Health. They were telling us they needed this, they needed that, and we had to, in a way, discuss with them, okay, what would the implication be if, let's say, we prioritize this feature instead of that, right? So there were multiple discussions that we had with the committee, which again comprises of the MOH, NAXA, and Mampu. And I would say from a government agency standpoint, they really helped us a lot as well in terms of prioritization. So we worked really closely with them. We were based there every day for meetings. And at one point before we launched, we were doing 1 UAT a day just for particular features that we were launching to make sure that it's public ready before we launch. So I think we have to make sure we followed the proper process while we were also moving very fast. We have to make sure we followed the proper process in terms of prioritization to make sure overall for MySejahtera there was a proper governance that we followed, so that in a way it also helps increase confidence from a user perspective. So they know that whatever decision that we make to the application has that consideration in mind, basically. So I think that's some of the top 3 challenges and lessons learned that we've gotten along the journey. Of course, there would be a lot more that we have as well. And probably our founder will want to write a book about it later on. I'm not sure, but we'll see about that.
Look forward to that, actually.
But I think this will
Wow.
continue to go on for the next year at least, because I think while COVID-19 has in a way stabilized, but we can't be complacent. Even we have to do our part in the community to prevent this spread. We have to make sure that we are checking into wherever we go, we are practicing social distancing and so on, just to make sure that this doesn't, or we don't get hit with a second MCO, which I think would be in a way a catastrophe for our economy, right? So I think we'll continue to be there. We'll continue to think about what's the next steps for MySejahtera, and from a product standpoint, think about what other features enhancement we can do to help the Ministry of Health, as well as help the public in terms of management of this COVID-19 pandemic. So yeah, I think that sums up my talk for today. So yeah, I'm happy to take any questions.
Yeah, okay. We will go to the questions at the end of the session. So right now, what we will be doing is, first of all, thank you so much for the very insightful talk. It was really, really very, very insightful and very informative. I really appreciated that. So right now, let's just move on with Hazwan. Let me introduce Hazwan, our second speaker. So he is actually he used to be in the banking industry, right? If I'm not wrong, and then for about 10 years, and then now he is actually the co-founder for DoctorOnCall, which let's bring forward Hazwan to share a bit about like what you are working on during the pandemic, and yeah.
Thank you.
Yes, we can see the video.
Yes, I'll share my screen right now. Thank you. Just a quick introduction about myself. I was, same as Royce, I was in consulting. I was in Accenture for about 10 years, and my primary focus was financial services and banking. My background, I was never in healthcare. until about 4 years ago when my ex-colleague Maren approached me and say that, you know, like the healthcare industry is quite behind in terms of tech disruption. That time you see a lot of like fintech and a lot of logistic tech companies are popping up, and healthcare was pretty much like 15-20 years behind. And we look around, we look what's some of the trends in the US, and we started DoctorOnCall. Right. So I'll quickly run through what we do, and then focus on the topic for today, which is pivoting in a pandemic. Okay. All right. Basically, let me just share. When we started DoctorOnCall, we are basically the first online doctor consultation platform where we provide prescription referrals, and some of corporate clients, we allow MCs as well. We connect patients to doctors through chat, phone, and video call. And from there, we also started our first, Malaysia's first e-pharmacy and medication delivery service. Right. So this is we had a good growth for the first 2 years, 2017, 2018, but nothing compares to the last 8 months during the pandemic. And if you look at the third service, we just launched our beta version, home visit health screening. So this is also a spin-off or another new product we introduced because of what some of the trends that we see since COVID-19 started. We also started our specialist booking and telehealth service. So, you know, during the MCO, there's a lot of limited travel. Patients can't really go to the hospitals, and then the specialists can't really see their patients. So they want to connect with their patients on via teleconsult. So we launched this service, and there's quite a good take-up from the specialists and the hospitals. And now you think about it, we also have quite a lot of requests from overseas who wanted to speak to our specialists. So just imagine you're in some of those countries that is still having thousands of cases daily, and they can't even like go to the hospitals properly. So they want a specialist second opinion and consult. So they do approach our platform and talk to the Malaysian specialists. And number 5 and 6, the health forum and blogs are basically some of our initial earlier growth factor, where we remember when we first started with the online consultation and medication delivery service. It is actually very hard to grow your website traffic from 5,000 to 10,000 to 20,000 to 100,000 a month, right? But what we notice is with regard to health-seeking behavior, a lot of people start their journey on Google. So we do tap into that segment where they are searching for various conditions and various healthcare-related searches, medicine as well. And once you capture those segments, you kind of like complete their journey from just seeking information to talking to doctors to getting the medication and whatnot. Right. So practically, our approach was to become the largest WebMD for Malaysia initially, to help us spur our growth. Right. So now, let me just just talking about COVID-19. It was back in late January and February, where KKM also approached us, but that time there's pretty much not many cases, right? We launched our virtual health advisory platform with KKM on the 19th of February, and they approached us just earlier that month, and to offer a virtual health platform where patients can speak to KKM doctors and ask about COVID-19 and whatever that they're worried about. And the thing is, they are, and remember that time there was, when we're having only about 20 cases on a daily basis. There's not a huge pressure to kind of look into all this tech initiative. But MOH that time was very forward-looking. Even with 20 cases, they wanted to offer this virtual health platform to the people so that they don't have to unnecessarily go to the healthcare facilities and whatnot. But just about 2 weeks after we launched, right, then the Tabligh cluster started and the European cluster started, right? So that's when it boomed. And that was also unprecedented. We were there when pretty much like there's no cases, and we were quite instrumental in helping defray the traffic from the government health clinic to the platform, right? So this is an overview of our partnership with KKM, where we provide the virtual health advisory, the self-assessment, and this is about about 2 months before the platform like MySejahtera came up, right? So all this done in a few days, where we divert the people to go and read on health blogs and our health blogs and forums. If you remember back in February, a lot of people are confused. We have thousands of people coming to our website daily, asking about, oh, what if, you know, I have a lot of bats at home, right? So will I get coronavirus, and then things like that, right? So there's a lot of misinformation. There's a lot of myth as well with regards to coronavirus. So we were, and there's not many resources around it. So people are actually coming to the platform to ask all these questions, right? But the last thing we want to do is actually get them the wrong info. So we make sure that our doctors and also KKM doctors are actually handling this, are addressing all these concerns like in a very professional manner, right? So we also introduced the appointment booking system later on with KKM, and this is early February, right? So KKM actually bring all about 40 doctors in a room to do a training to use this platform, and this is this is what I said. It was very impressive of KKM to be very forward-looking and get this started before the whole COVID spike started. And this is the thing, speed really is our only differentiator, right? So all these things that I've spoken about, all is done in 4 days. So between the 11th to the 16th of February, we basically, my CTO and his team like didn't sleep and to get all this platform up, right? If we have taken a bit longer, right? So the platform may not be that useful anymore, right? Because if you remember the number of cases that when we jumped from like 1 case daily to a 20 case to 100 cases daily, it was a matter of days, right? And during this time, this is all that matters, right? Speed, right? So when without this, people will be flooding the health clinics, government health care facilities to do the check, to get all the concerns addressed. And that's the last thing that the KKM want, right? So people flooding their healthcare facilities. And throughout the period, this is about 4 to 5 weeks, when Royce mentioned about during March and April, right? So there are 5.2 million people like come through the system, through the virtual health platforms. About 2 million completed the self-risk assessment, and they also asked for speak to a doctor function. About 40,000 of them talk to doctors through chat, phone, or video call. And from there, we also diverted about 5,000 of them to do a test for COVID. So if you think about this funnel concept, right? So this is how, I mean, I think all government agencies should see how they can actually use digital to reduce the crowd in the facilities, right? Especially in these days and age where they want to reduce with social distancing and whatnot, right? So just imagine this 5.2 million people, if they were to flood the healthcare facilities and get worried unnecessarily, right? So this is really like showing the power of technology in terms of funneling these people so that only those that is really high risk, that really matters, can go to the healthcare facilities and get tested, for instance. Right. So just if you recall correctly, like, you know, what happened during the MCO and lockdown, the shops are closed, people staying away from clinics and hospitals, food and online order search, everyone is at home suddenly, right? And suddenly everything is possible digitally, right? So you can get even your mother to buy things online and no one is complaining about it, right? And this was, I think, for programmers or founders who are in this call, right? This is the only potentially once in a lifetime opportunity, I would call it, in terms of capturing your customers onto your digital platform, right? And how did it impact us, right? So of course our traffic went up, but it also, like, there's a positive and negative, right? We have 3 times system crashes in a week, because if you remember in early March, the traffic went from, our daily traffic is only about 30 to 40,000 visitors, but overnight after they announced the tablet clusters, it went from 40,000 to 120,000 to 400,000 a day within 2 days, right? So how do you actually handle those kind of growth? I was harping on my tech team in terms of, hey, double up the server or triple up, or, you know, because we are on a cloud, but you realize that no one really, like, expand their servers 10 times the size overnight, but we had to do it. Sales is up, but there's also, like, a huge impact on our operations. There's a lot of customer complaints from various angles because this thing happens really fast. We have increase in terms of orders, but believe it or not, during the MCO, we have about 20% staff turnover as well, right? Because some people can't cope with the stress, can't cope with the angry customers, and remember, this is new normal, right? So unprecedented times, doing really, like, new stuff, that something that we have never done before. And the last thing is, you know, the good thing is there's a lot of partnerships and sales opportunities that pop up during that period as well, but that also impact our service SLA. So with the fast growth, there's also a lot of these negative things that you should look out for. Now we learn how to deal with all of this, right? The increase in sales also means an increase in the operations and customer complaints and whatnot. Right. So I'll share this quickly. What do we do to scale quickly? I'm not gonna drain down this slide, but if you want to know more about this, you can approach my CTO, KK, right? So basically, if you look at the orange line, that's just in February versus the blue line, which is the March one. Look at the kind of traffic, daily traffic that shocked our server, right? So that's when our server started crashing, and according to my CTO, these 5 items that's listed here is his secret sauce. But he said, I don't mind sharing it. So if you want to know more exactly what he did, because I can't really explain all of this to you guys, you can approach him on LinkedIn, perhaps. It's KK Ng. And the other things that we did was resource augmentation. We suddenly, during that time, we were the first one to launch the COVID-19 testing at home. And again, launching this new product, typically would take us like 4 weeks, 6 weeks, you know, a month, the fastest to roll out a new product to. And with when the government decided, okay, we want to allow some private players to do COVID-19 testing at home. That was early March, about 10th of March, right? We get our platform up and ready in a matter of 2 days, and then roll it out. Right. So again, speed is an essence here, because had we missed that early part, because after that, just about 10 days later, all the competitors and the players are in the market. So you don't capture the opportunity fast enough, right? So during pandemic, things are done pretty much overnight in a matter of days. So what we did was we reshuffled our staff to focus on hot product, mainly the testing in e-pharmacy during the MCO. it's also a time to remove weak links, right? We know that who can, handle stress, who can't. The other thing that this is what I also learned from, I'll share here. This is when I was with Alibaba eFounders program. This is how you should view the people in the organization, right? So you will have a superstar, which is the scale is performance versus values, right? So you might have a high performance, but they call it wild dog, which is really do anything to get to what it takes, but it may go against the values of the company, right? So you don't want that, right? So you want majority, and you also don't want rabbit. Rabbit means bad performance, good values, bad performance also like doesn't help the organization. So you want to kind of push everyone to the middle, and then and up, right? You find your superstars, right? Where high performance, high values, right? So this is the metrics how we see our, how we map the people in our organization as well. I know some of my staff are in this call, so don't worry, because they don't know where they are mapped to. Only we do, only I do, and my partners. During that March period, because everyone in my organization pretty much work around the clock, right? So we give them good, whoever comes to the office get good food, not pizza, but real food, right? So this is part of the things that we want to get everyone engaged, because it was such a highly stressful period, right? My tech team pretty much worked 24 hours and non-stop, right? So, and then slowly we introduce a few things in terms of prioritization for order fulfillment, so that we have automatic identification of our medication orders. So this is part of our internal automation, a differentiated patient experience and touch points. So we, in fact, during that time, we strategically remove our WhatsApp channel, because a lot of requests come through WhatsApp and we cannot handle it. So it only results in poor customer experience. So we force everyone to come to our digital channel and a few channels that can be monitored properly as well. And finally, the automation in terms of, there's a lot of corporate insurance claims that was done manually before. Now we have a lot of automation. You see, the pandemic kind of like push all these things that we've been wanting to do in the last 6 months to 1 year. It's always getting deprioritized, but then when the volume comes, you just have no choice but to kind of pull it through, right? So it's the good thing is that we get to kind of push some of this initiative faster and then it benefits us in the longer term. And Royce mentioned about prioritizing, right? This is our dilemma, right? During the pandemic, we have almost like golden opportunity to grab some of the short-term sales, I would say, right? So there's B2B deals, there's the certain sales like COVID-19 testing. We see that as a short-term spike for testing, but we have to balance it in terms of the long-term values of our organization. So we always, we had a lot of debate internally in terms of, okay, should we pursue this? Should we not pursue this? Should we deprioritize certain things? So there is a lot of, this is how we actually put it in a form of metrics, right? So something that will help with the short-term cash flow, high priorities, and something that will help us build the long-term value, right? So once you are clear on this, right, so everyone can have their peace and work accordingly. Now we still have a long list of things that we want to do, just on a daily basis. Me and my other two partners, and key management team, will just sit down and say, okay, is our prioritization going to change this month? Are we going to introduce new things and certain things? So this happened almost on a daily basis as well. I would say that during pandemic, I call it once in a lifetime opportunities. Before this, for the last 2-3 years, when it first started DoctorOnCall, there's a lot of comments here and there, and I think Royce also, like, when he built MySejahtera, there's a lot of people say, oh, why don't you do this? Why don't you do that? You know, how about these features? How about that features? People always compare to the, you know, billion-dollar company, like, you know, oh, how come your chat doesn't look, how come DoctorOnCall chat does not feel like WhatsApp chat? Come on, like, we are a 2-year-old company, and then, like, we don't have the kind of coffers like WhatsApp has and Grab has, right? So, but why I call it once in a lifetime opportunity is, during this time, a lot of new digital platform pop up, right? And people are more forgiving in terms of the perfectness, how perfect your platform is, right? So people are okay to just do simple transaction on WhatsApp, for instance, even though that's not the most seamless way. And if you think about it, if you have co-founders or tech founders in this call, you know, when we first launched, right, I spoke about COVID-19 testing. We are the first one to have a full-fledged COVID-19 testing platform with online booking, payment gateway, automated notification and whatnot, right? And we did it within 1 or 2 days, right? And when the other major hospital chains or large healthcare group, the traditional players, when they roll out in the market, many of them are using the basic phone call, call hotline, WhatsApp, or Google Forms and all that. Right? So think about it, like for programmers or tech companies, how fast we can move and introduce something that is the product that is a lot better than the traditional or large players can do. And many of this is driven by the fact that we, as a smaller companies, we can move faster than some of the traditional players. And this is actually the golden opportunities that all of us in a startup has, right? We can move fast, we can roll things out fast. We're okay. I'm almost done, right? I mean, I also said, you know, during the pandemic, you know, there's no, I mean, typically things that you do in, like, you know, 4 to 6 months is reduced to 4 to 6 days. So contracting partnership can be done in a very fast and simple manner, all fine via Zoom. And also, like, for us, right, we talk about ecosystem a lot. So one thing we learned from Alibaba is, I mean, you need to build your ecosystem, right? And for us, before this, we have this kind of ecosystem, but during the pandemic, we realized that there's a lot more opportunities open up, so we can expand our ecosystem we focus on completing our ecosystem in the market, right? So I think that's all I have to share for today, right? If you have any questions, you can approach me in the Q&A or approach me directly on my LinkedIn. Thanks.
All right. Thank you so much, Hazwan, for sharing that. Okay, so because I think we will just go through some questions that we have from the team, because right now we sort of overshot a bit on the time. So we are only going to be answering like the more relevant question, because I think some of the ones that we've already gone through, Roy or Hazwan has already actually answered to them. So one of the more, I think I will just start with Roy first.
Sure.
The question from the floor is there any difference between Sri Lanka and also MySejahtera? I think a lot of people were asking that.
Yeah, plenty, I would say.
Yeah.
So I think,
would you like to share your video, by the way, right?
Yeah.
Sure. You see my facial reaction if I'm lying, is it?
Correct. I'm just kidding. Oh, there we go.
Okay. Yeah, so Sri Lanka was essentially developed by the state of Selangor, and I think they initially launched first towards the end of May. But I think the main problem statement that we wanted to address was from a national basis, what's the feature that will be used by the public overall. And I think that's where MySejahtera comes into play. So I think there was a period where people were adjusting between, there were 2 options to scan. Some premises or businesses would prepare both the QR codes, or some eventually move from one to the other. Both information essentially will go back to MOH in the long term. I think how Sri Lanka did it was a bit differently. I think their convenience came from storing the cookies in the application so that you don't need to download a mobile application. While for MySejahtera, actually, You also can scan using camera, but we encourage people to scan using the mobile application so that from a data cleanliness standpoint, the data that you are sharing or the information that you are sharing towards MOH is in a way cleaner. So I would say we are moving towards that national approach of maintaining MySejahtera as a whole, but there will be a period where people are using both QR scans. And from an overall standpoint, I guess essentially all the data still flows back to MOH. So I think that's the nutshell answer.
Okay, cool. One of the questions maybe both of you can answer is what was the most unexpected or stressful part of the process from conception to the launch, and also especially the maintenance part, since that now that you're already on a flow, right? And it's the post-pandemic, so to say, at the moment.
Okay, so maybe I'll start first. Where do I even begin? For me, most stressful was, of course, the period where we were dealing with the Penjana surge, where there was about millions of people going into our application. The power of 50 ringgit, I would say, or what our team would say. Yeah, that was one of our most stressful periods. I think, like Hazwan was sharing on the technical side as well, where, actually shout out to all our technical team, I think, from Hazwan's team as well as my team. Our tech team really worked around the clock in terms of how we can scale, how we can bring up the servers, and essentially strategies such as isolating the servers, making sure that no particular module is compromised from a user experience perspective. So I think that period of search was probably one of the most stressful for myself.
Yeah. How about Hazwan?
Stressful part?
Yeah, the most stressful part, especially like now that after we sort of going into like post-pandemic sort of situation about the maintenance and as well.
Yeah, I think the most stressful part for because I think for us was, yes, there was a spike that we don't want, because we are also representing KKM during that time. And we don't want people to start complaining and oh, your platform crashed, this doesn't work, I can't hear. So that was the part where I think my guys like increased the server size 10 times within a day, right? Because we just don't know, and potentially this is a lesson learned as well. So we know whenever there's a major announcement and all this, we will be more prepared. Plus, this is haven't happened in 100 years, right? So who would have prepared for this? But people are very very forgiving, and they understand. The other stressful part was because we are a startup. We also chase every single day that there's a delay in the platform means we're losing sales or we're losing customers, right? So that was me, that was the part that we have to bribe my tech team quite a lot with food and
yeah, definitely. So there's a question here for Hazwan. An influx of new visitors is getting on during COVID-19. So we have been quite unfamiliar with this new model, for teleconsultation. So how do you feel like you reach the Malaysian public? Because they are not so comfortable with physical consultations now, right? Can you elaborate a bit more on that? And how do you adapt the platform?
To be honest, in terms of getting to speak to doctors was quite natural for everyone during that time. It's not, of course, online. You can't do a lot of physical examination, but our KKM doctors that was handling that, they are actually specialists. So they can actually ask a lot more questions than doctors typically ask in a physical setting. So a lot of adjustment there. And to be honest, people are not really awkward about doing that consult. Everyone is quite, and they get used to it as well, right? And a lot of times, things that they want to ask doctors, they can just ask over a virtual platform. So there's not a lot of issues in terms of them onboarding, but using it for the first time, that helped. Right? Because before this, for you, I mean, I remember back then for me to start using my taxi, then before, it took me like a month to just even try for the first time. Once you try it, then you kind of hook to it, right? So same thing with us, right?
Yeah.
How did
Yeah, okay. Interesting. So means like when people started using it for the first time, then people sort of like more comfortable with using it, right?
Yeah.
Okay. So is there anything that like how do you actually work as a team? So do you guys actually like work separately or online, or is that something that you were kind of struggling with as well? Questions for
Uh,
both of you.
okay. Royce, you want to go first?
Oh yeah, sure. So for me, there was no working from home essentially. I was based in Cyberjaya the whole time. So
Okay.
it was a good time. Roads were clear. So yeah.
Nice.
Essentially, we also did benefit from the being there on the spot. Our tech team, of course, was based offsite. So for me, for the client-facing side, we had to manage that communication with our tech team very well. But from a client interface perspective, we are essentially always there with the client. So
Okay.
any discussions, decisions that needed to be made happen quite fast, instantaneously, and really helped us in terms of prioritization and making decisions from a product standpoint. Then after that was just communication, deliberation with our tech team, which will happen online through that. So I would say it's just a adjustment period that we went through, and I think it worked out pretty well.
Okay, cool.
So for us, it's the same as well. The team that was handling the virtual health advisory, I have my tech team is on standby 24/7. I was in KKM every single day for 2 months, I guess. I just and most of the time, just to make sure that no one, there's no complaints, everyone's happy. And when there was a spike, I remember the doctors, group of doctors who were handling the calls, don't even have time for lunch. So that's why I was like, okay, guys, we need we need to bring in lunch. So thanks to a few I think my Bergeret sponsored like lunches for quite a while during that
Wow.
for
Okay.
the KKM doctors. So they're very happy with it. So thanks my Bergeret team as well.
Shout out to
It's
them,
just that
right?
it's just that imagine like doctors. I mean, they're handling all these lot of customers. Sometimes the people are also not being very nice to them.
Yeah, that's true.
Right. So it's a new thing. As you said, it's not just for the patient, it's also for doctors who are experiencing this teleconsult for the first time. Right.
Yeah.
So a lot of things that you assume things in physically, you have to kind of like make sure that on the phone, it sounds as courteous as possible. So else like people would think, like it will be a bit nasty on the phone.
Yeah, that's very, very true. So there's a question here for Roy. Okay, so can you explain a bit about the differences in product design and also the development considerations for the, like, because you mentioned KPISoft is always like B2B. So what is actually the differences when you came to creating something for the consumers?
Yep. So I think from that sense, while we are B2B, but essentially the users of our core application would be the employees of the organization themselves. So essentially there are also the end users in mind. So I think pretty similar to releasing to public. I think, sorry, not really similar, but there are key differences. But from that sense, from an end user perspective, they are still the people that will be using the application. Maybe from a B2B standpoint, we did benefit more from easier cascading of information when it comes to using the application. Like we were able to conduct training sessions, train the trainer sessions in terms of how to fully utilize the application as a whole. While from a public standpoint, you don't really have that luxury. So it really comes down to making it very simple for them to use. So user experience comes a long way. And really for them to explore and use it, right? And then also I see that there are a lot of materials online once we launch, even third parties or random YouTubers making YouTube videos on how to use MySejahtera, which I guess in a way helps the process as well. All these independent contributors that are interested
The
in
unsung heroes.
the unsung heroes, exactly.
Yeah, okay, cool. I think we sort of like kind of out of time at the moment. So why not we just wrap up the session by answering the last question, like what do you think like moving forward, like, the future, and whether how do you see it's gonna be for the next like maybe 3 months?
Well, for MySejahtera, I guess of course, we are always looking at what other features we can help with, because we are a public-based application. So anything that can help the public as well as help MOH, whether it be through dissemination of data or whether it be through giving them a quick, easy feature that helps them to save time, then that would be our focus. So we are still in talks with the core committee members, which comprise of MOH, NAXA, and Mampu, in terms of what's next for the application as well, or how do we make it more sustainable, maybe even potentially moving beyond COVID as well. So that's something that's still in the discussion, still in the works, but yeah, I guess you would look forward for more updates once we announce it.
Yeah, okay, that's very interesting. All right, how about Hazwan?
Yeah, so thanks. Actually, I have to thank Royce and MySejahtera as well. The arrival of MySejahtera has relieved a lot in terms of the traffic and also some of the stress on our team, because I think that was the time when things are a lot more stable and patient tracing can be done very digitally. Because before this, I remember during that time, the doctors calling the patients, calling the district health office to coordinate things and whatnot. Right, but for us now is great that COVID has subsided in Malaysia. But the world is still deep in it. So we are seeing how we can actually play a role as we have very good set of healthcare professionals and doctors and services in Malaysia. How we can help some of the people from overseas.
Yeah.
And for us as well, as I mentioned earlier, we just introduced a new service called Doc at Home. So this is also just as a new way of doing things. That people are expecting a phlebotomist or a nurse to come to the house, do a blood test. People are so used to more digital things now. So we see while Malaysia is changing to adapt to new normal, right? What else can we offer so that it's more convenient, safer for people, right?
Yep. All right. Thank you so much for your answer. Okay, so right now, basically what I would like everyone to, thanks so much for joining us, like for all the audience that has joined us so far. We actually want to wrap up the session with a feedback session here. So we actually did prepare a Google form here. You can scan the QR code, or like later on we will be forwarding, because the session is recorded, we will be forwarding the recorded session if you guys would like to look back at this recording of the talk, and would really appreciate if you guys can leave us a feedback session on like how you thought the talk went, and give us some other feedback on like how we can further improve our product talk. Yeah. So beyond that, I'd just really like to extend our thanks from Women Who Code, and also like from all of us from the team, the organizing team. Really thank you for Hazwan and also Royston for taking the time today to just join us and share your knowledge on like how you guys actually did so much changes, and like along with your tech team as well, and just everyone on your team to actually build something like this to really help with the situation that we went through during the pandemic. So yeah, really thank you so much. Yeah.
Thank you for having us.
Yeah.
Yeah. Have a wonderful weekend, everybody.
Yep.
Thanks,
Thank
everyone.
you so
Thank you.
much.
Just to mention to the participants, we are also hiring, and we can more women coders on the team.
Very nice. Well, the opportunity is now, right?
Yes.
Right, thank you.
To go into detail.
Thank you. Right.
Thank you.
Thank you.
We still have a few more minutes if anybody just really wants to chat, I guess. But yeah. You guys can just scan the link and then answer later. You don't have to answer it right now.
Yeah.
If that wasn't clear.
Okay.
We can actually, we can stay on and chat if you guys want.
Yep. All right.
For what, 5 minutes?
Wow,
I'm just kidding.
Thank you so much for attending our talk, everyone.
Yeah, just because it's digital, we're not limited to this. You can also reach out to Royston on LinkedIn as well, and Hazwan.
Yes.
So you can, I believe they had answered a lot of the questions within the second half of their sessions, but if you do have any more of them, you can reach out to them directly. They're quite responsive.
Yes, and also like if you would like to get to know more about like Women Who Code, we do have a Slack channel that you can join us and also get to know like what our community actually is doing. Yeah.